In BC, a deadly toxic drug crisis without end.
You have no choice but to seek out this drug.
In the effort to save lives, some activists want to go beyond sanctioned measures like supervised injection sites.
This is North America's first cocaine, heroin, methamphetamine compassion club.
But for authorities, that's a step too far. That Vancouver activist operation was shut down, but there is support for more access to a so-called safer supply of hard drugs, from the provincial coroner to doctors to those trying to reclaim control over their lives. Four times a day, 7 days a week, Dennis Pelzer comes to this health clinic on Vancouver's downtown east side. He says it saved his life. If those programs didn't exist, where would you get your drugs?
Right off the street.
Like right out there?
Yeah.
How many times do you think you OD'd?
I was ODing like almost every time I used. It didn't matter how much I used, I went down.
This is called the SAFER program, the first of its kind in North America. About 100 patients come here to get this, fentanyl, prescribed by a doctor, prepared by a pharmacist. That's why it's considered safer than what's on sale on the streets just outside of here. Could you ever have imagined you'd be coming in here and getting prescription fentanyl?
No, no.
Like a doctor prescribes it, you get it, it's clean, and you get to use it here.
Yeah, exactly. I'm like, whew, wow, all right, sign me up. After we get it in the cooker, we throw the water in, and then these are tourniquets.
Even in a province known for bold innovations to reduce drug deaths, fentanyl, distributed by a government-funded clinic, is a big step. Dr. Christy Sutherland launched the program.
Well, I never thought I would be doing this. Like, I also agree, it's quite bizarre. I'm a family doctor, I should be doing pap tests and working on people's hypertension, but I landed in this community, and this is the services that they need, so this is what I created as a family doctor. For me, the way I look at it is that drugs exist, and society also exists. And what is the relationship between drugs and society? Right now, we have the worst relationship possible. Organized crime controls the supply chain, they control the dose, they control the price, and they are unregulated. So if you were to sit down and set up the worst system possible to make it racist and violent and kill people, this is the system you would create.
The drug death crisis in British Columbia is so acute, there's really not much controversy about a government-funded clinic distributing fentanyl. But here's the contentious part, and lives hang in the balance. How can the province quickly expand the number of people who get so-called safer tested drugs? And consider these two numbers. Currently, about 5,000 British Columbians get drugs from some sort of government-supervised program. It could be fentanyl or an opioid replacement drug. But according to a coroner's report, 225,000 people in this province are at risk of injury or death because they're getting their drugs on the street. That risk extends far beyond the downtown east side, and the question remains, how far should access to safer supply extend? You're looking at what was the distribution center for the Drug Users Liberation Front, or DULF.
So for our heroin, we always use red bags, and the meth is in green bags, and the cocaine is in clear bags.
It is an activist group pushing for change. And back in September, co-founder Jeremy Calicum invited us to watch him package their version of a safer supply with drugs they obtained illegally.
Yeah, so this is North America's first cocaine, heroin, methamphetamine compassion club.
Though not supervised by medical staff, the drugs here were tested at a university. Carefully packaged with detailed labels from the precise contents to a warning.
Okay, that's 33 bucks.
Yeah. 7, and we're good to go.
They were sold to club members at cost. Funding from the provincial government paid for the testing.
Half a gram of tested, clean, no cut, but it's also highly addictive and dangerous to people who don't use it. Right? So.
DULF says no one has died using their drugs. This kind of program, if it were to expand, what would the result be? What would the net change be?
Obviously, there'd be less deaths, there'd be less overdoses, There'd be less of a tax on our healthcare system, less of a tax on policing. It'd also be a lot of money taken away from organized crime, because these are drugs that organized crime would otherwise be selling to these people at inflated prices. What we're doing right now is we still are buying it from the black market and then taking away a margin of those profits by selling it for a much lower price. But if we could get those drugs from a pharmaceutical company, which is really no problem, like chemists can make this stuff up in no time at all. So you have the people's names here, right? Like Airbnb, Canada Goodies.
This is where Dulf got its drugs, traveling through the dark web to find suppliers. As Calicum said, they bought in bulk on the black market from Canadian sellers, the packages mailed to them. Buying drugs on the dark web may have been a step too far. After almost a year in operation, the Vancouver police swooped in and shut Dulf down. The provincial government withdrew its funding, and the members of the Compassion Club presumably left to buy their drugs on the street.
Dulf saves lives!
Dulf may not have the backing of the provincial government, but it does have support in the community. Keep in mind, many of the bold steps taken in the downtown east side have been led by activists, from needle exchanges to supervised injection sites.
Save supply! Or we die!
If people don't have access, then they're just going to die in the streets.
And just as Dulf was being shut down, a panel of 21 experts issued this report for the coroner. The bottom line, with 6 people dying every day in BC from toxic drugs in September, it said access to a safer supply must be expanded quickly, even without a doctor's supervision. The panel said our urgent attention must be on creating access to alternatives to the unregulated drug supply for people who use drugs. But before the recommendations were even announced, the provincial government said it would not support providing drugs without a prescription.
First question today.
At the news conference about the panel's recommendations, BC's chief coroner, Lisa Lapointe, was asked about the decision to shut down Dulf, which police say was trafficking drugs.
I can't speak specifically to those, to that action, but I suppose I would say that if you see somebody in a burning house, you feel somewhat justified to smash a window. And this crisis is massive. 225,000 people are still at risk of death every day.
One capsule each time?
Yeah.
And then you go over to one of these tables?
Yeah.
Dennis Pelzer is one of the fortunate ones in a medically supervised program with access to a safer supply and plans he couldn't have imagined without it. A stable life, and soon he hopes a job. You know, there's some people who hear about this program and they say it's wrong for doctors to prescribe fentanyl. It just feels wrong to them. What would you say to people who say that?
They don't know what it's like to be addicted to fentanyl. It's such a hard thing to explain to someone that doesn't do drugs. Once you get hooked on it, it's scary, you know, like you have no choice but to seek out this drug.
As you can see, Dennis was very open about his story. In fact, he thanked us for coming down to talk to him, saying he's pleased the clinic that has been so important to him is getting attention. Coming up, I'll speak with BC's Minister of Mental Health and Addictions about why the province isn't following recommendations on safer supply that the chief coroner says are needed to save lives. That interview is up next on The Breakdown. Amid BC's spiraling toxic drug crisis, growing calls for the province to give addicts wider access to safer options, from doctors.
Organized crime controls the supply chain, they control the dose, they control the price, and they are unregulated.
To the chief coroner.
If you see somebody in a burning house, you feel somewhat justified to smash a window.
So why is the province saying no? Well, Jennifer Whiteside, BC's Minister of Mental Health and Addictions, joins us now from Victoria. Thanks for doing this.
Happy to be here, Ian.
Earlier in the program, we showed our audience a so-called Compassion Club. They would get meth and cocaine and heroin from the dark web, have it tested at universities, and they say that no member of their club had an overdose after using their drugs. Now it's been closed down. How do you feel about the work they were doing?
Well, you know, Ian, there's no question that the toxic drug crisis is taking a tragic and unacceptable toll on the lives of British Columbians, and it's happening in every corner of the province, in every community. It's impacting people from every walk of life. It is one of the most challenging and volatile public health issues that we're facing. And there is no question that we really need all hands on deck. We need to be working across many partner groups, our health authorities, our community partners, to be trying to turn the tide on the toll that the toxic drug crisis is taking.
Yeah, but if I can jump in and say, sorry, but I just want to, in terms of having all hands on deck, what about something like DULF, as they're called, the Drug Users Liberation Front, providing safer supply to 40 people?
You know, Ian, we have a prescribed safer supply program that we really have pioneered in British Columbia, that came into being at the beginning of the pandemic, and was one way to try to ensure that we didn't see the public health response to the COVID-19 pandemic having a worse impact on people who rely on the illicit drug market. And that program is still, while still in its early stages, is showing some very promising results, and is something that, you know, our public health officer is looking at very closely, that we're adapting to the sort of post-COVID period that we're in. And that is a very important program that we continue to invest in and work with prescribers and doctors and nurses who are on the front line working with that program.
But as you know, BC's chief coroner earlier this month issued a report. It came from a panel of 21 experts. There was a police chief there. There were, you know, just a blue ribbon panel of people who were involved. And they said, and we've reported these numbers, that there are about 5,000 British Columbians who are under the kinds of programs you were talking about that are medically supervised, but that there are 225,000 British Columbians at risk right now, tonight, this weekend, who may be buying drugs off the street and may be poisoned because of that. And they say that the provincial government needs to expand very urgently access to a safer supply. So I just wonder, what is being done in that regard? Let's pick your time frame over the next month, let's say.
Yeah, and there is no question, Ian, that the toxic drug crisis is taking a really devastating toll on British Columbians and on our communities. And when it comes to our prescribed safer supply model, in fact, working on scaling that up is precisely what we are doing. We have added prescribers. We have seen the College of Nurses just implement certification standards so that nurses can diagnose and treat opioid use disorder. You know, in this province, we have about 100,000 people who are diagnosed with opioid use disorder. We have, as you said, about 5,000 people currently, approximately, enrolled in our prescribed program, and about, on any given month, about 24,000 people who are connecting with other medically treatment programs, such as opioid agonist therapy, where they're receiving something like methadone or Suboxone as an opioid alternative to help help keep them stable. So we have made strides over the last few years to provide better access to these programs, and we are doing work every day across our healthcare system to scale up access.
Having read that coroner's panel report, here's the problem. The problem is urgency, right? Like, I still wonder what the answer is. What happens to the people who have, were vulnerable to street drugs and poisonings? What happens this week, next week, the week after that?
Ian, that is something that I think about every day, that my government thinks about every day, that the doctors, the nurses, the peers, the outreach workers, the Indigenous peer workers think about every single day. How do we turn the tide on what is a vicious and volatile public health crisis? And that is why the work that we are doing around working with doctors, with nurses on prescriber models to scale up work that is not being done on this scale really anywhere else in Canada. I mean, British Columbia is leading this work, and I'm very grateful to public health, to all of our doctors and nurses on the front lines who have been guiding us in this work.
Jennifer Whiteside, thank you very much for speaking with us.
Thank you, Ian.
So how effective is BC's response to the toxic drug crisis? That may be answered soon. You heard the minister mention that the provincial health officer, Dr. Bonnie Henry, is about to deliver a report looking in part at a safer supply.